soldiers have to believe that mental health care is available. Our goal is to provide comprehensive therapy, the best available evidence-based care we can, with the goal being that every patient will make it back and become full fighting members of the Canadian Forces and carry on and have a full career.
Le programme de santé mentale des Forces canadiennes est un programme dans lequel les professionnels travaillent dans un milieu multidisciplinaire, c'est-à-dire les travailleurs sociaux, les psychologues, les psychiatres, les médecins, toute l'équipe de santé en fait travaille dans un sens commun pour le bien-être du membre.
If a member calls in or comes in and is asking for mental health treatment or mental health support, we would first of all ask them some questions and do a preliminary assessment just to find out a little bit more about them, a little bit more about the situation, and figure out what the next or what the best course of action would be.
Bien, le but du processus thérapeutique, c'est d'identifier au tout départ le problème. Lorsqu'on peut comprendre et identifier un problème, c'est beaucoup plus facile d'établir un plan de traitement. Et les plans de traitement, les objectifs thérapeutiques, en fait, oui, c'est de développer les habiletés nécessaires à la personne pour reprendre en main les symptômes qui sont souffrants, pour se réintégrer au niveau du travail, au niveau social, au niveau de la famille.
The big umbrella therapy that most psychologists use nowadays is called cognitive behavioral therapy, which is just a fancy word for saying we're looking at the interaction between your thoughts, your behaviors, and your emotions. So most of the time when people come in, they want help because they're feeling sad or anxious or angry, and they want to work on that, but it's very difficult to directly manipulate how you're feeling.
We do our assessment, come up with a treatment plan which is often multidisciplinary. We usually don't just use meds. We may start medications, we may refer them to a clinical social worker or a psychologist for therapy. We may refer them to an addictions counselor to do an addictions assessment or for addictions treatment, or any of a number of group programs.
So as a medical officer, our role involves referring patients to additional mental health services such as social workers, psychiatrists, psychologists, padres. In addition, while a member is being followed for any mental health problem, they're still with us. So we're the continuity of care. We're the ones who are following the member every step of the way.
It starts as soon as they come through the door. We have a very robust case management team who works with a lot of our patients. Our med techs are all trained in being able to identify when somebody is potentially having a crisis. Our clinicians are always open door, and they stay with the patients until patients receive definitive care.
Frontline, we have a walk-in system here, services for our clients to be able to access a mental health nurse, a social worker, other people in our team without a doctor's referral.
A lot of the guys or the women out there, they usually feel pretty comfortable coming to the med tech. They know that we're there to talk. So if someone has concerns or they feel agitated, things like that, we're the ones that will actually be the first eyes on.
L'aide que moi je donne, ça dépend vraiment de l'individu. Si c'est quelqu'un qui veut aller de l'abus d'alcool à une consommation selon les directives à faible risque pour ne pas avoir de problème, des fois je suis comme un coach pour dire OK, quand que tu bois de cette façon-là, que c'est abusif, regarde qu'est-ce qui se passe, c'est vraiment de les sensibiliser.
Because one of the most important things that will happen that will make therapy successful is the therapeutic alliance you have with the patient. So if that doesn't work, if it doesn't click, you need to, if you feel comfortable, address it with the person to say, look, this is just not working for us. We'll try to make it work. We'll try to find solutions together. But if at the end of the day you're just not comfortable, it doesn't click, it's my responsibility as a therapist to find someone else for you.
Les aumôniers d'unité agissent comme intervenants de première ligne. Étant donné que les aumôniers sont toujours avec les membres des unités, assumant une présence constante, ils sont mieux en mesure de détecter parfois ce qui pourrait ne pas aller chez un individu, et c'est principalement un individu qui pourrait hésiter à demander de l'aide.
For probably the majority of people who come into mental health are seen through our psychosocial services. So that they don't need to go through a medical officer, they don't need to see a physician's assistant or nurse practitioner, they don't need to see the shrink. They can come in with their problem set. If it's that primary, that lower layer, the psychosocial stuff, or dealing with other stressors in their life, and get seen usually within a week or two to begin counseling with one of our well-trained social workers or mental health nurses.
Myself, I've deployed to Afghanistan, Bosnia, working collaboratively within the team there. We're typically deployed as a small mental health team consisting of a psychiatrist, social worker, and nurse.
Mental illness can happen to anybody. No matter how many years of service you have, whether you're old or young, experienced or inexperienced, nobody is immune.
Plus on attend, plus le problème devient de plus en plus complexe et prend de plus en plus de temps à rectifier.
You're not alone. It's not something that you see as normal, but it's something that if you don't let us know that there's something wrong, we can't help you.
Let us know what's going on. Feel free to speak your mind, be blunt about it. We're here just to listen and to help.
If you're wondering if you should talk to someone in mental health, if you're wondering if there are services to help you, there are.
The message that we have to get out there is one of hope. Resources are available and treatment can be effective. And I think given what their job is, what we ask of our men and women in the CF, we owe it to them to provide them the best care possible.